detects the state of the body. So it detects things like temperature, blood osmolarity, blood nutrients, hormone levels, inflammatory mediators, emotions, and pain. So this is just an example of their feedback mechanism, right? So the CNS gives some input to the hypothalamus. The hypothalamus is going to release a hormone that's going to travel to the anterior pituitary. The anterior pituitary is going to release a hormone, and that hormone will go to the target gland. The target gland will secrete a hormone. It'll go to the target cell, and then you have the physiologic effect. And then when there's the appropriate amount of hormone circulating through the body, it sends a message back up to the hypothalamus that the secretion of all these other hormones do not need to be done. So it's kind of like a chain reaction. So the hormones that the hypothalamus produce are going to be synthesized in the hypothalamus and then travel to the posterior pituitary. Right? The posterior pituitary hormones are going to be your ADHD and your oxytocin. And then there's hypothalamic hormones that regulate secretion of the anterior pituitary hormones. So this is going to be your GH-releasing hormone, somatostatin, dopamine, TRH, CRH, and gonadotropin-releasing hormone. So basically, again, the hypothalamic hormones are going to go either to the posterior pituitary or they're going to go to the anterior pituitary, and they are going to stimulate the pituitary to release another hormone. So just to recap, the hypothalamus releases neurohormones. These are going to enter portal circulation, travel to the anterior pituitary endocrine cells with receptors. And then the anterior pituitary releases hormones that are going to enter systemic circulation and then travel to cells with receptors for those hormones. The pituitary gland is a pea-sized endocrine gland, and it is located at the base of the brain. They call it the master gland because its hormones control the function of many target glands and cells. And it has two functional units, the anterior lobe and the posterior lobe. The anterior lobe produces ACTH, gonadotropins, which are your LH, or luteinizing hormone, and your follicle stimulating hormone, or FSH, and then your GH and your prolactin. The posterior lobe stores and releases ADH and oxytocin. So basically, the ACTH that the pituitary releases stimulates the adrenal cortex to produce cortisol. TSH stimulates the thyroid to produce thyroid hormones. GH stimulates the liver to produce IGF-I. FSH and LH stimulate the gonads to create sex hormones. And prolactin stimulates the breast to make milk production. So a lot of the hormones are regulated by this negative feedback system I talked about, right? So sensors are going to detect a change in hormone level and then adjust secretion to make the levels normal. So if a sensor is going to detect too much of a hormone, it will decrease production, and vice versa. If it senses too little of a hormone, it's going to increase production. Your book basically compares it to a thermostat, right? If you have your thermostat set, your thermostat set to 70. If it reaches 75, it's going to shut off the heat. If it drops down to 65, it's going to turn on and increase the heat to get it back to that stable temperature. are several different tests to measure hormone function. They may indirectly measure the function by measuring the effects of the hormone on body. So, for example, measuring blood glucose, right? Glucose is not a hormone, but by measuring blood glucose, you're indirectly measuring insulin levels, and insulin is a hormone. So, blood tests, these are going to measure levels at a specific time. Urine tests are used to measure hormones or hormone metabolites. Stimulation tests look at hypofunction, where suppression tests look at hyperfunction. Then there's various genetic tests and imaging studies. So they can do isotopic imaging, MRI, CT, ultrasound, PET scan, and DEXA. Right? So doing the imaging is going to look at the function of these different endocrine structures. Disorders of the endocrine system are going to have various effects depending on the disorder. They may affect growth and development, energy metabolism, muscle and adipose tissue distribution, sexual development, fluid and electrolyte imbalance, and then different inflammatory and immune responses. The prevalence and incidence of these various disorders is going to depend on the metabolic disorder. So here's three of the main ones, right? So diabetes, an incidence of diabetes is 1.5 million cases per year. According to the CDC in 2015, 30.3 million people in the U.S. have diabetes. This is 9.4% of the population. 1.25 million people have type 1. So the remainder of those are type 2. For ethnicity, 7.4% are of non-Hispanic whites have diabetes, 8% of Asian Americans, 12.1% of Hispanics, 12.7% of non-Hispanic blacks, and then the highest incidence is 14.9% of men and 15.3% of women of Native American or Alaskan Native heritage. I actually have one of my students in my PhD cohort who is a Native. She's Ho-Chunk. She is devoting all of her time in research on diabetes in the Native community. So there's a lot being done to help with this, but not enough. So obesity, I know we are not directly covering obesity, but it is important to know the prevalence of obesity because it's one of the risk factors for type 2 diabetes. So 38.8% of adults, which is 93 million people, and 20.6% of youth ages 12 to 19, plus 17.4% of children 6 to 11, and 13.9% of children 2 to 5 in the U.S. are obese, and this is based on 2017. So it's quite a large chunk of the population. Overall, women are going to have higher rates of obesity than men among non-Hispanic Black, non-Hispanic Asian, and Hispanic adults. Obesity is higher in adults ages 40 to 59, followed by 20 to 39, and the lowest is in ages 2 to 5. The overall trend of obesity is rising from 30.5 to 39.6% since 1999 for adults, and just in the last year alone, it's gone up 1.9%. There's a rise in children obesity or childhood obesity as well, whereas it used to be 13.9%, it's now 18.5%, and that was a 1.3% increase just in this last year alone. And then the thyroid disorder, there's really no specifics on incidence of prevalence of thyroid disorder. It's not one really that people are tracking for whatever reason. So here's your risk factors. Genetics, environment, and lifestyle are all going to play a role in the development of various metabolic disorders. Right? Clients with these disorders in general have a genetic predisposition. And then there's the environmental triggers that play a role, so things like infection or exposure to different environmental toxins. Lifestyle also plays a role, so again, here's obesity or weight gain. Lack of iodine in food sources, we'll talk about that when we talk about thyroid disorders and different things like that. So prevention is going to be key. And when we talk about type 1 diabetes, there really isn't primary prevention strategies. However, for type 2 diabetes, it's all going to be related to those lifestyle changes or modifications. So things like diet and exercise are going to be important for management of both types of diabetes and obesity. Right? So again, for type 1, it's not going to prevent it, but it still will help with the management of type 1 diabetes. Secondary prevention relates to preventing or delaying complications of diabetes, whether it's type 1 or type 2, and that's going to be done by looking at the diagnostic test. So basically, when you think of secondary prevention, you're thinking screenings and diagnostic tests. So tests like your fasting plasma glucose and your hemoglobin A1C are going to be used to diagnose and manage type 1 and type 2 diabetes. The BMI aids in the diagnosis of obesity. It's also an indicator of a risk factor for type 2 diabetes. Serum electrolytes can supplement the diagnosis and complication of any of the disorders. And then there's your thyroid function test. So your TSH, your T3, your T4, all of these are going to help determine whether or not there is thyroid disease present. Basically, endocrine disorders occur either because of hypofunction or hyperfunction. And some different causes of hypofunction are going to be congenital defects, destruction of the gland, aging, certain drug therapy can cause atrophy of the gland, receptor defects, and then there's unknown reasons. Hyperfunction can be caused by excessive hormone production, so from overstimulation or hyperplasia of the gland, from tumors,